This video is meant to describe the benefits, indications, and contraindications of motorized cervical traction. We will discuss what a patient should be feeling during traction, and a short demonstration will be shown because we want all patients to be comfortable and to have a complete understanding of the techniques to be used and the reasoning behind it. There are several benefits of traction, including decreased pressure on involved structures such as an impinged or pinched nerve root, which in turn reduces pain associated with that condition. Traction can also decrease muscle spasm by lengthening the muscle and interrupting the pain-spasm cycle. However, too little force produces no effect, and too much can cause increased muscle contraction. But don't worry, your clinician won't just throw you in and crank it up. They will start off slow and ensure that they find the weight that is of most benefit to you. Intermittent traction also improves blood flow and allows for faster healing, and the stretch on the muscle decreases adhesions and causes muscle relaxation. Radiating pain caused by a herniation can also be decreased because the disc is forced back into place. Conditions that cause pressure on vertebral bodies, facet joints, and nerve roots can benefit from traction, such as hypomobile vertebrae, disc protrusions or herniations, degenerative disc disease, nerve impingement, narrowing of foraminal space or stenosis, facet pathologies, muscle spasms, and adhesions. Contraindications, or conditions in which traction should never be used, are any type of vertebral fracture, acute injury, spondylolisthesis or hypermobile vertebrae, questionable vertebral stability, such as in elderly patients, spinal cord compression, infection, tumor, or malignancy, severe herniations, because this can increase degeneration, and any vertebral artery dysfunction. Also, traction should not be used on pregnant women, patients with hernias, peptic ulcers, glaucoma, cardiovascular disease or hypertension, or any kind of arthritis. If you have any of these conditions, please be sure your clinician is aware so that the right decisions can be made and you can be given alternate treatment to ensure your safety. There are two different techniques for traction, sustained and intermittent. Intermittent traction has a treatment time of about 20 to 25 minutes with on and off cycles of the weight, usually set at a 3-to-1 ratio. For example, full weight on for 30 seconds, and 1/3 of that weight for 10 seconds. Sustained traction, however, maintains the tension for duration of the treatment, but the time is usually half that of intermittent traction, which is about 10 minutes. During sustained cervical traction, you will feel a pulling sensation from the base of your skull through your neck. The force will gradually increase until the max weight of 25 pounds is reached, or until you begin to feel uncomfortable. During intermittent traction, you will feel a cycle of that pulling, stretching feeling and relaxation during the off times. The amount of tension is gradually increased with this technique as well. And remember that even though treatment for this one is longer, you get brief rest in between the on time. Cervical traction can be administered to patients in a seated position or lying on their back, which actually allows for greater relaxation and requires less traction force. Remember, it is important for you to stay relaxed during your treatment, otherwise a proper stretch of the muscles cannot be achieved. Also, don't ever be afraid or hesitate to tell your clinician if you are uncomfortable with your treatment or are experiencing any pain.
Is cervical traction, motorized cervical traction. We've got our patient in supine. Once we got them in on the table, we want our pads to be touching the mastoid process. We can rotate these in or out to make the patient more comfortable. We'll just have them let us know when it's comfortable for them. We also have a strap that we're going to just secure the patient's head to the device. Once we've got this, we want to just make sure our table is in the locked position. You can see there's a knob. We have to lock them in position. Once we've got them here, if you come over to your device, there's a release or a rope release button. If you hold that and pull out, that's going to give you slack to be able to hook up your rope. And then same thing to take the slack out, just push the button and then it'll take the slack out. Once we've got them here, we can also take the table up or down to increase flexion of the neck depending on what pathology we're trying to create traction for. Once we've got there, we're going to do cervical traction. So as you can see on the screen, there are icons that you can just follow right through. So we're going to do cervical traction. We're then going to go into edit so we can edit all of our different steps. One of the things we want to remember on cervical traction is if we come to the speed, we want to try to keep it low. You can do 30, 50, or 100 for cervical. We're going to do 30. This is going to gradually pull them to their total pressure of cervical traction, and it's not going to make it uncomfortable for the patient. So we're going to leave that at cervical. We can also come to our time. Time for cervical can be anywhere between 20 and 25 minutes. For intermittent, for static, 10. It can, so for just our demonstration, we're just going to show you how you can just put in the time of a treatment plan of 25 minutes. We can also switch the steps of how long it takes them to get to full traction. And so if we go in, we can switch to the steps, and that gives us one step to just get up to full cervical traction. Once we get there, we can come up to our edit, our minimum and maximum levels of pounds. Cervical traction, the maximum pounds per pressure that you want is 25, and minimum is 1/3 of that, which would be 7, yeah, like 8, we'll say. Once you've got that, you can come back to the home or back to the next page, and then you can hit your treatment time. Once we've got our treatment time, you can do that. That's also wants to be 3-to-1 ratio, so we've got it 60-to-20, or we can go 30-to-10. Once we are there, we want to just make sure and look over all of our steps to make sure we are in the right place. And once you are ready to start, you're going to just hit the start button, and that is going to start your treatment time. And then just monitor your patient throughout the treatment, make sure they're comfortable. You also want to give them a kill switch. They have a kill switch that they can push at any point. If they feel uncomfortable, they can hit it, and it will stop the treatment altogether.